I invite our next speaker, a doyen in the world of ophthalmology, a passionate teacher, an able administrator, and a prolific surgeon. Padma Shri Dr. T.P. Lahane is someone whose leadership has taken the Bombay Ophthalmological Society from strength to strength. Today, he'll be speaking to us on rebuilding an organization, the Bombay Ophthalmological Association. Looking forward to hearing you, sir.
सर लगा which one sir which one
Yes, flight got cancelled. They got a new flight. Excuse me.
slide show करो ना slide show ना okay sorry for the late good afternoon everybody on the dais and up the dais. Now this topic is some different topic and it was given to me by Prashant because he has seen the development of BOA. So I will just Bombay Ophthalmological Association. The problems in front of BOA was the conference was less than 300 delegates when I took over. The maximum consumer cases against the ophthalmologist and the harassment of the ophthalmologist by the cashless people. So these were the problems, and then there was a general body meeting where I took over the. Now basic is gaining the members' confidence was the first thing. Now here we organized the CME in different medical colleges because that time there was no money with BOA. Then hands-on training of the FECO and SICS to not only the resident but also the faculty, because that time faculty was also new for the FECO. And workshop of the SICS, we conducted 3 workshops of SICS and also the 7 workshops of the FECO emulsification. Now the membership, BOA was having only 700 members, and now today the non-members ophthalmologists were requested to join BOA. Outside Mumbai, ophthalmologists were also permitted to join BOA, and gradually the BOA member increased to now near about 2,000. The annual conference, that time when I took over, all the members were invited for the annual conference, requested to come. Trade was also invited, and first conference was attended by 700 delegates, and the trade 32 people took this part in the conference, and this was the first time that we started the live demonstration in the Bombay Ophthalmic Association. Now basically whatever we collect from trade, it should go to the doctors. That is what we always feel. And the registration fees was only 500 for all the delegates for 3 days. In that, we were giving 5 lunches, means 3 lunches and 2 dinner, and 3 breakfast, and also a bag. This time we gave a bag of near about 3,000 rupees. And the maximum benefit which we are collecting, it should go to each and every member. And today also our fees is only 1,000 rupees. Bombay ophthalmologist, our registration fees is 1,000. Now the consumer cases are due to own colleagues. Who are those colleagues who criticizes in front of the patient, who later on goes in court of law? Now who are those colleagues? Those are close to you. They are not away from you. They are very close to you. And own friends, your own friends. And this is only curse to the doctors. So everybody is united except doctors. We criticize our friends when we talk very sweet and on face, and once she goes, then we say to gada hai. It means only the doctor community, we criticize each other. You go to the IAS, IPS, advocates, politicians, They will not criticize except the doctors. I think that is curse to our society. How we reduce this? Now we expose one person who told that the lens is implanted opposite. It means upside down. And because of that, patient has got the glaucoma. That patient went in the court of law. And then I called him on the dais, Girish. I called him on the dais. I told him कि भाई, you have told this patient कि upside down होने से glaucoma हुआ है. You show me one anywhere research paper कि where upside down myopia, yes, -2 myopia, I agree, but it is not a glaucoma. So what you have told to the patient is wrong. Now tell that patient that you advise him wrongly and ask him to take the case back. And this was publicly in BOA in front of 500 people. And once he was asked every question there, and second day that patient removed the case. And from that day till date, this was 2004, till date, there is not a single case, consumer case, against the Bombay ophthalmologist in court at all. Not a single case. It's only Mumbai where there is not a single case against a doctor. So that is because we are not criticizing because of only my pressure, that they know I will call them and in front of everybody I will ask them the questions. And because of that, nobody is criticizing each other. So that should happen. So we have reduced the consumer cases. The cashless is a big problem. So they were giving only 18,000 rupees to the cataract and they want a premium lens and we should not charge more. So general body meeting was called, problems were discussed, and then it was unanimously decided that we ban the cashless. We have banned the cashless from near about now 16 years. We are not practicing. Few of the corporate hospitals are practicing, but we are not practicing. And now this insurance, they are now ready that copay. It means you can operate whatever the insurance is going to give, but now they are allowing us a copay. It means patient can pay. That is what is the discussion, and within 1 month or 2 months we will solve this issue, not for Maharashtra, but for total India. So copay will be permitted in the cashless. This is just because of ban on cashless for 16 years. Then the other thing is live demonstration. Only the scientific live demonstrations was permitted. No trade-driven live demonstration or a single presentation in BOA till date from the company. So that is what is our motto. And the different and new advances were demonstrated, not only the cataract in conference, so very well attended. This time it was attended by 1,500 delegates, the small, live demonstration. Now the trade partition, the large number of the trade participation was the key to success. So trade is also our one of the partner who helps us. And we take care of the trade, give them lunch, give them coupons equal to the doctor so that they can talk to the doctor, meet the doctor. And because of only one thing, that we are giving the lunch. So few people are there who are here, who gave us 1 lakh rupees, and minimum 20 people from them they attend. We gave them 3 days coupon, so it goes to near about 1 lakh, more than that. It is a neutral, we are not earning from them, but that 20 people are coming there, that is more important. And so, the trade, once it is called that BOA, this is the date, second day you will get near about 3 crore rupees in 1 day. So that is because of the, you can say the trade, which definitely helps us, and because of that, we are more successful in Bombay Ophthalmic Association. And so, fees of 1,000 is sufficient for us. After that also we make a profit, and Mumbai today, we are having near about 16 crore profit of Bombay Ophthalmic Association in last 14 years. Now under the leadership of Dr. Ragini Parekh, from 14 years, Dr. Ragini is taking care of the scientific committee. Now 6 members were make the scientific program, and which every delegate want to attend and learn. Because whenever we do the program, in the program only scientific theme, Ragini sits with the people And with that, we decide what is the topic, what is the new topic, and Ragini gives the topic to the faculty. Now, these are the topics, and she organizes the scientific material. And because of that, you will see the people are in the hall and not outside the hall. Because the topics of their interest are there in the scientific material, and maximum delegates are always inside the hall due to the excellent program. It means it is a program that attracts the people inside the. Now, active committee. Every year there is a new and old organizing committee with active members who always take pain for a successful program. Because so many members are there, so many. So they work day and night, and because of that, this society is successful society. And the maximum national faculty is invited, and they are honored with a ticket. But few people are there. One of the person from AIMS asked us, the Titel sir, one of the person from AIMS asked us this business class ticket, 50,000 rupees. Self-invited, ask हमको बुलाओ, and 50,000 ticket reimbursed. I told no, we will not reimburse that type of ticket. So some people are there, but we near about the reimbursed ticket of everybody. Stay and registration we organize. Maharashtra faculty also we call, and faculty from our own. So near about 386 people as a faculty, they are there in the Bombay Ophthalmic Association. And because of this, I think the association is successful. I think the key is less fees, registration fees should be less, excellent scientific material. We must attract the trade, but we should not be, you can say, listen to the trade. And if you do that, then we will be successful. And for that, I think the people who are working day and night, like Dr. Ragini and her 6 people who are working day and night, they have definitely done good thing. And so Bombay Ophthalmic Association is an excellent organization politically, scientifically, and also for togetherness. If you call tomorrow you are not practicing, everybody will stop the practice. That is what the Association of Mumbai. Thank you very much.